Hand hygiene. Hi, I'm Lauren. I'm going to be doing your head to toe assessment today. Can I have you verify your name and date of birth?
Ava Zorzicki, January 31st, 2005.
Okay, awesome. I'm going to start doing my head to toe. I'm going to start with an assessment of the nose, mouth, and throat. I'm going to first check your facial expression or your facial features. They are symmetrical. I'm going to look at your nose. It is symmetrical, midline with the face. There's no abnormalities, no swelling, no inflammation of the nose, no drainage. I'm going to palpate your frontal and maxillary sinuses. Please let me know if there's any discomfort or pain when I do so, or tenderness.
No tenderness.
Okay, no tenderness of the sinuses. Now going to palpate down the bridge of the nose. Once again, let me know if there's any pain or tenderness. Okay, no pain or tenderness of the nose. There's no swelling, no abnormalities, no masses or nodules of the nose. I'm going to have you occlude one nostril at a time and breathe in. Breathe in. Okay, the nostrils are patent bilaterally. I'm going to go ahead and move on to my assessment of the lips. So just looking at the lips, they are symmetrical. They are even on both sides. They are pink, consistent with ethnic background, and they are moist. There's no lesions or cracking, and there's no lesions of the nose as well. I didn't say that. I'm going to go ahead and now look at the inside of the mouth. You could say ah for me. Okay, the pharynx is pink and moist. I'm gonna go ahead and have you say ah again. Okay, the uvula is pink and moist. It's midline and it rises with phonation. The tonsils are pink and moist. There's no lesions, cracking, or abnormalities on the inside of the mouth, and the tonsils are grade 1. I'm going to look at the buccal mucosa and the floor of the mouth. Okay, the buccal mucosa is pink and moist. The floor of the mouth is also pink and moist. The tongue is midline, pink and moist. There's no abnormal growths. There's no lesions. There's no abnormalities on the inside of the mouth. I'm going to go ahead and look at your teeth and your gums. Okay, the gums are pink and moist. There's no lesions, abnormalities, cracking, abnormal growths. The teeth adhere to the gums and they are white and straight. And then if you could open your mouth. And there is no dental caries on the teeth. All right, I'm going to now move on to my assessment of the eyes and ears. So in practice, I tested my patient's distant visual acuity using the Snellen chart. It was found that at 20 feet away, the patient could read, and the patient was 20/20 vision in the right, left, and both eyes, and this is cranial nerve number 2, and it is intact. I also tested my patient's near visual acuity using the Rosenbaum test. This is newspaper print. Read at 14 inches away, the patient was able to read. They had 20/20 vision in the right, left, and both eyes with no visual aid, and this is also cranial nerve number 2, and it is intact. I'm going to now test the extraocular eye muscles. If you could follow my pen, just with your eyes and not with your head. Okay, the 6 cardinal fields of gaze are intact. This is cranial nerves number 3, 4, and 6, testing the extraocular eye muscles. I'm now going to look at the eyes. If you could pull down your lower lids. Okay, the conjunctiva are pink and clear. The sclera is white. The corneas are clear, bright, and smooth. The irises are brown. The upper and lower lids have no edema or redness or swelling. The eyebrows are evenly distributed and they are brown and they are symmetrical, and then the eyelashes curve upward and outwards and they are also evenly distributed. I'm going to go ahead and put on gloves now and palpate your eyes. So I'm going to be palpating the lacrimal gland, the upper and lower lids, as well as the eyebrows and the bony orbit. Let me know if there's any pain or tenderness when I do so, okay? Oh, you can close your eyes. Okay, that lacrimal gland, upper, lower lids, eyebrows, and bony orbit. Is any pain or tenderness?
No.
Okay. There is no drainage from the lacrimal apparatus. There is no edema, redness, or swelling of the upper and lower lids, and there is no tenderness throughout the eyes. So I'm now going to be looking at the pupils. I'm going to be checking perla, which is cranial nerve number 3. I'm going to first measure them. They are about 5 millimeters in diameter. They are equal and round. I'm going to shine this light in your eyes real quick. You could look at me.
If I was assessing respirations, I would assess respirations for 30 seconds, watching the rise and fall of the
Okay, the
chest.
pupils are reactive to light, and I'm going to have you look at the pen, look at the wall behind me, look back at the pen, and look at the wall behind me, look back at the pen. Right, and they are accommodating, so this is cranial nerve number 3, and Perla is intact. I am now going to be looking at the ears. So if you could pull your hair behind your ears real quick, thank you. The ears are, the top of the ears are in line with the eyes. They are symmetrical. There is 3 lesions on each ear. There is no redness, swelling, no drainage from the ear. I'm going to be looking in the actual ear canal now. Okay, there's no redness or drainage or obstruction of the ear. And there's no redness, drainage, or obstruction of the ear canal on either ear. Now going to be palpating the external ear, tragus, and mastoid process. Please let me know if there's any pain or tenderness. The external ear, tragus, and mastoid process. Okay, no pain or tenderness of the ears. Now going to be testing your hearing. I'm going to have you close your eyes and raise whichever hand you hear the sound on.
So in practice, I tested my cardiac visual acuity using this chart. She tested 20 out of
Okay, cranial nerve number 8 is intact. I'm going to be going on and moving to my skin assessment. So just looking at the skin, it is pink, it is consistent with ethnic background. It's clean, dry, and intact. There's no like abnormalities or swelling or edema. I'm going to be palpating the upper and lower extremities here. So the arms are warm to the touch. The legs are also warm to the touch. The skin is firm and smooth. I'm going to be looking at your capillary refill of your fingers and toes. Capillary refill is within 2 seconds. And capillary refill is within 2 seconds as well on the toes. I'm going to be looking at clubbing. If you could put your hands together like this. Okay, there's no nail clubbing. I'm going to be checking for skin turgor. Okay, skin turgor is brisk. It's within 2 seconds. I'm going to be looking at your nails. The nails are pink, consistent with ethnic background. They are smooth and they are slightly rounded. I'm going to be looking at the toes as well. They are, there's no polish, but I can see that they are slightly curved. They are rounded. They are smooth and they are pink and consistent with ethnic background. I'm now going to be looking at the hair. So I'm going to actually be palpating the hair real quick. Okay, it is evenly distributed. It is blonde, brownish. It is straight. I'm going to be looking behind the ears and at the nape of the neck for any parasites.
And then we go ahead and check clubbing present, beautiful.
At the nape of the neck here. And there is no parasites behind the ears or at the nape of the neck. I'm now going to be assessing a lesion here. I'm going to be doing this one right here. So just looking at the lesion, it is symmetrical. The borders are regular. The color is brown. The diameter is about 3 millimeters in diameter. And has this changed over time? Nope. Okay. It is slightly elevated and there is no exudate. I'm going to be looking at the neck now, if you could look straight at me. So the neck is symmetrical. There's no bulging masses or scars of the neck. I'm going to be moving on to the assessment of the neck and heart vessels now. I'm going to be looking at the carotid arteries here. Just looking at the arteries, there's no bulging or masses, no abnormalities or swelling. I'm going to be listening with the bell of my stethoscope for a bruit. While I do this, I'm going to have you hold your breath in, and I'm going to be listening in 3 places with the bell. Okay, I'm going to have you take a deep breath in and hold your breath.
So now I'm going to go ahead and assess the pulses. So in practice, I would do this on my patient, but I'm going to go ahead and do it on myself. So my pulses are right here. Mine are +2, smooth, even, and regular bilaterally. And then I'm going to...
Okay, no bruit is heard on auscultation of the carotid arteries. I'm going to be palpating one side at a time. Okay, the pulse is +2, even and regular. The pulse is also smooth. I'm going to be moving on to the assessment of the heart vessels. I'm going to have you go ahead and lay down first. I'm going to assess the precordium. Let me know when I'm palpating if there's any pain or tenderness.
Perfect. Plus 2, smooth, even, and regular bilaterally. And go ahead and flex your foot for me. I'm going to check the dorsal pedal.
Okay, there's no pain or tenderness of the precordium. There's no masses or nodules felt, and there's no pulsations. I can have you go ahead and sit back up here, and I'm going to be assessing your heart sounds. I'm going to be listening with the diaphragm of my stethoscope first.
Okay, now
I'm going to start at the aortic in the second intercostal space,
We'll make sure we can see ya.
the pulmonic in the second intercostal space, Erb's point in the third, tricuspid in the fourth,
We'll take a listen. We're going to try our best.
and mitral in the fifth. Okay, I'm going to be listening in the same 5 places with the bell of my stethoscope. Aortic, pulmonic, Erb's, tricuspid, and mitral. Okay, the heart sounds are even and regular. S1 was heard loudest at the apex, which is around here, and then S2 was heard loudest at the base, which is up here. There's no extra heart sounds or murmurs heard on auscultation of the heart. If there were any abnormalities or if the pulse wasn't even and regular, I would auscultate at the mitral valve right here, or at the apical pulse, for a full minute. Normal finding would be that the rate is 60 to 100 beats per minute, and it should be even and regular. I'm going to go ahead and move on to my assessment of the respiratory system, or the thorax and lungs. I'm going to just first assess your breathing. So a normal respiratory rate would be anywhere from 12 to 20 respirations per minute. I can see that the patient is breathing normally. The respiratory rate is even and regular, and it is unlabored. I'm going to go ahead and assess for level of consciousness of the patient. So do you know your name?
Eva,
Do you know your date of birth?
January 31st, 2005.
Do you know where you are?
The annex,
And do you know what year it is?
2025.
Okay, awesome. So the patient is alert and oriented ×4. They are conscious and alert. There is no distress. The facial features are relaxed. I'm going to go ahead and assess the chest now. So just looking at the chest, it is symmetrical and elliptical. I'm going to go ahead and measure the AP diameter here. So anterior transverse diameter is 1 to 2, which is a normal finding. I'm going to go ahead and measure the costal angle at the ribs. It is less than 90 degrees, which is also a normal finding. The patient is sitting upright with no tripoding, and I'm also going to check for any pain or tenderness of the chest. Okay, so no pain or tenderness of the chest wall. There's no masses or nodules felt. I'm going to check the chest first, chest stability now. If you could breathe in and out for me. Okay, the chest wall is stable. It expands and it expands evenly and regularly. I'm going to now go ahead and listen to your lung sounds with the diaphragm of my stethoscope. In 6 places anteriorly, 6 places posteriorly, and 2 places laterally. So take a good deep breath in and out every time my stethoscope touches your chest.
Symmetrical. Sorry, I'm gonna come down a little bit with no swelling or deformities. And then I'm gonna go ahead and feel for tenderness, warmth, masses or nodules. If you feel any tenderness, and then go ahead and move your shoulders for me. No crackles at either of the shoulders. So we're gonna go ahead and I just want you to do the motions I do. So we're gonna go ahead and extend our arms out
Sorry,
front
I'm
of us.
really
That
hungry.
flexion. Your arms next to us. Here, you go.
Okay, I'm gonna look at the posterior now. Once again, breathe in and out.
Hyperextension, beautiful, and then abduction. So bring your arms up to a T, bring them back to your body, adduction, and then circumduction. Do some circles for me. And then I'm gonna have you do it against resistance. So shrug your shoulders. And then you're gonna do that flexion right out in front of you against resistance, and then go out to the side against resistance. Beautiful. Active range of motion is +4 bilaterally in the shoulders. And then if you wanna go ahead and lay down, we'll do the hips. So I already assessed the lips for swelling, symmetrical and deformity. So I'm now going to go ahead and feel for masses, nodules, tenderness, in warmth. So hips are warm. She's old. Take a look. Hips
Okay.
are warm.
The breath sounds are clear to auscultation in all lobes bilaterally, anteriorly, and posteriorly. I didn't hear any adventitious breath sounds, but if I did, these could be crackles or wheezes. Crackles are high-pitched popping noises, and wheezes are high-pitched musical noises. I'm going to go ahead and move on to my assessment of the peripheral vascular system now. So I'm going to be starting by assessing your arms. So just looking at your arms, they are pink, consistent with ethnic background. They are clean, dry, and intact. There's no redness, inflammation, or swelling. I'm going to be go ahead and palpating for temperature or tenderness. The temperature is warm to touch. Are they tender at all? Okay, so no tenderness of the arms. I'm going to be looking at clubbing of the fingernails. So there's no clubbing. I'm going to be looking at capillary refill. Capillary refill is brisk within 2 seconds. I'm going to be assessing your pulses now, so if I could have you take off your wristwatch for me. I'm going to be feeling the radial pulse first, which is at the thumb side. And they are +2, even and regular. I'm going to be looking at the brachial pulse right here. They are +2, even and regular. I'm going to be looking at your legs now, so just upon inspection, they are symmetrical. There's no discolorations, ulcers, or varicose veins. I'm going to be palpating for temperature, tenderness, and edema. So they are warm to touch. Is there any tenderness? Okay, I'm going to be checking for edema at the pretibial and malleolar aspects of the legs. There is no palpable edema of the pretibial and malleolar aspects of the legs. And there is also no tenderness. I can't feel any swelling, no abnormalities or discolorations of the legs. I'm going to be assessing for capillary refill. Capillary refill is brisk. It's within 2 seconds. Going to be palpating your pulses. I wouldn't feel the femoral, but it's right here about the hips. A normal finding would be that it's +2 amplitude, even and regular. Going to be assessing your popliteal pulses at the back of the knees. These are hard to feel, but a normal finding would be that they are +2, even and regular. Going to be looking at the posterior and the inside of the ankles, posterior tibial pulse. These are +2, even and regular, and then I'm going to have you flex your foot up, feeling for the dorsalis pedis pulse. And these are +2, even and regular as well. So everything is a normal finding. I'm going to go ahead and move on to my abdominal assessment and have you lay down here. Do that for you. All right, so I'm going to first inspect the abdomen. The abdomen is flat, it is symmetrical, the skin is clean, dry, and intact. It's pink, consistent with ethnic background. I can't see any visual pulsations, no inflammation. The umbilicus here is inverted. There's no inflammation. It is midline with the abdomen. There's no exudate, drainage, or once again, no inflammation of the umbilicus. I'm going to go ahead and auscultate the abdomen with the diaphragm of my stethoscope, starting at the right lower quadrant and moving upwards. Okay, the bowel sounds are normal active in all 4 quadrants. If there was no bowel sounds heard, I would listen for a full 5 minutes before saying that they were not active. So I'm now going to listen with the bell of my stethoscope for an aortic bruit right below the xiphoid process here. Okay, there's no aortic bruit heard on the abdomen. I'm now going to use light palpation. I'm going to have you bend your knees for me. I'm going to lightly palpate in circular motions of the abdomen. Please let me know if there's any pain or tenderness. Okay, no tenderness of the abdomen. There was also no guarding and no masses of the abdomen. I wouldn't at this time perform deep palpation as this is advanced practice skill and improper usage could cause harm to the patient. Sorry. But I am going to assess for CVA tenderness. I'm going to have you sit back up. And let me know if there's any pain or tenderness.
No tenderness.
Okay, so there's no CVA tenderness on our patient today. I'm going to go ahead and move on to my last assessment of the day, which is the musculoskeletal assessment. So I'm going to first confirm that you haven't had any surgeries on your shoulders or your hips.
No.
Okay, perfect. I'm going to first inspect your shoulders here. So they are symmetrical. They are even on both sides. There is no visual swelling, deformities, no scars, no masses. I'm going to go ahead and palpate. Let me know if there's any pain or tenderness. No pain or tenderness?
No.
Okay. I'm going to go ahead and have you move them around. There is no crepitus, no increased temperature with movement. There's no masses or nodules felt at the shoulders. I'm going to go ahead and test your range of motion here. So I'm going to have you flex your shoulders, extend, abduction, adduction, and then little circles, which is circumduction. So the patient has active full range of motion in the shoulders bilaterally. I'm going to go ahead and assess your muscular strength now. I'm going to have you do a shoulder shrug against my resistance, and then flex your shoulders against my resistance and abduct them. Okay, the patient has a plus size strength and the shoulders bilaterally. I'm going to go ahead and have you lay down, and I'm going to assess your hips now. So just on inspection of the hips, they are symmetrical bilaterally. They're even. There is no visual abnormalities. There's no swelling, no scarring. I'm going to go ahead and palpate them for any tenderness. Let me know. Is there any pain or tenderness? Okay, there's no masses or nodules felt at the hips as well. I'm going to go ahead and have you move your hips around now. There's no crepitus and there's no increased temperature of the hips. I'm going to now assess for range of motion. I'm going to have you abduct one at a time, adduct. Same thing on the other side, abduction, adduction. I'm going to have you bend your knee here and internally rotate, externally rotate, and same thing for the other side, internal, external, and then once again doing little circles with one at a time. And this is circumduction. Okay, the patient has active full range of motion in the hips bilaterally. Now going to just assess for your muscular strength of your hips. I'm going to have you press up here, press up. Okay, the patient has a plus 5 strength in the hips bilaterally. I'm done with my assessment for the day. I'm going to put you in a safe, comfortable position with your call light near. I'm going to perform hand hygiene, provide privacy once again, and go document my findings.